Welcome to Rooted and Real, a podcast centered around all topics in the behavioral health space. From mental health to addiction and everything in between, hosts Margo and Ashley take a deeper look at topics impacting us every day. The show is for anyone and everyone with a passion and a desire to be better, understand, and grow. Join us as we get rooted and real.
Hello and welcome back to another episode of Rooted and Real. My name is Margo Hyde alongside Ashley Hickey, Chief Communications Officer and Chief Operations Officer here at the Root Center for Advanced Recovery. Today we are joined by Cameron Breen from Liberation Programs. We are going to be talking all about harm reduction, overdose numbers, all this ahead of International Overdose Awareness Day coming up on August 31st. Cameron, thanks so much for being here.
Thank you for having me.
So Cameron, why don't we start off by you telling us a little bit about your role at Liberations and what it is that you do. You've been here for almost about 2 years now, you were saying.
Yeah, I work as a street outreach case manager for Liberation Programs and also a drug checking technician. So those two roles are a bit different, but they all fit into this kind of same space of just meeting people where they are. One is street outreach, working with people who are unsheltered, connecting them to housing solutions, to shelter, working with them, making sure they have basic needs stuff as we try to get them documents, ID, social security card, birth certificate, and working with them to build safety plans in their lives while they experience unsheltered homelessness. And then the other portion is drug checking, where we have a program where we have a spectrometer. People bring in small portions of substances. It's about the size of a grain of rice, and we test those substances for any adulterants. We can give people a general understanding of what is actually the makeup in the drugs that they're using, so they can make better informed decisions, potentially avoid overdose, and just have a general understanding of what the actual drug supply looks like and the autonomy of knowing what they're actually putting in their bodies.
And before this, you were at McCall Behavioral Health. We actually met when you were doing their harm reduction rover. You were bringing it to our clinic up in Torrington. So you seem to really have a passion for harm reduction and doing this line of work. Tell us a little bit about why it is that you got into it.
Myself, I am a person with lived experience. I've been in recovery for 9 years now. I'm a person who also has experienced overdose. I've lost countless friends and loved ones to overdose. And harm reduction in and of itself seems as though it is the ideal solution for a very complicated problem. It's pragmatic, it's meeting people where they are, it's working with them, it's not based in judgment, shame, or stigma. It's simply understanding that people's drug use happens for a large facet of reasons and a lot of variables, and people don't really recover, get well, or even experience lives that are worthwhile without human connection. And I think that human connection piece is really what it's all about at the end of the day. And when someone feels that you care about them, that you're not judging them, and you're just showing up, there's a lot of space that offers to build relationships, build rapport, and that's where meaningful moments happen.
For sure. And I think too, it's going back to that human connection. And I know part of harm reduction, there's a lot of folks that question harm reduction and question the effectiveness of harm reduction with folks. And I find that it also comes down to just information. Like, there's a lack of understanding of what it means to be using substances and what it does to individuals' lives and what that harm reduction really means. So can you talk a little bit about the education that you're providing to folks to help discredit that stigma that comes with it?
Yeah, I think constantly I hear over and over and over again that harm reduction itself is like enabling someone to use substances. It's making it easier, and therefore people are going to continue to use because harm reduction is available. Because historically, the way that we've looked at drug addiction is, if we throw as many negative consequences at the person as possible, they will stop using drugs.
That word consequence comes up a lot.
Yeah. And unfortunately, most folks that work within this space know that one of the criteria for substance use disorder is continues to use drugs despite negative consequences. Mm-hmm. And then the system that surrounds those people says, we'll throw as many negative consequences at them as possible and expect them to stop using drugs. And what happens is they lose all connection with anything human, things like jobs and relationships with family, friends, loved ones, you name it, and they have nothing left to connect to. And then, of course, they connect with drugs. In a lot of circumstances, folks connect with drugs until they die. And so, in and of itself, offering like the pragmatic solution that is the work of harm reduction, overdose prevention, risk management, whatever we need to label it as, it's really offering education to understand what's going on within the drug supply, what's happening when they're using drugs, safer ways to consume drugs. There are clearly safer ways to consume drugs than others, and it moves things out of what folks call as like the harm reduction gap. And the harm reduction gap is essentially that if you're I guess the best way I could describe it is that if you're a person who is thinking about drinking, underage, obviously not something that I'm promoting, but if you're thinking about drinking underage, you can ask anyone and everyone as a kid, who that drinks, of like safer ways to actually engage in that act. And we have a million different harm reduction related solutions to alcohol that were just not seen in the same light. So with the harm reduction gap, because something exists in this illegal and illicit market and people can't feel comfortable or feel stigmatized or shamed in actually talking about any of their substance use, they can't learn about safer ways to consume those substances and avoid things like infectious diseases, and you name it. There's a million things that can come with injection drug use and other like illicit drug use when it comes to actual physical harms.
Yeah, and not to start this like rambling downward spiral into bias and people's opinions. However, as you were talking, I heard what I kept thinking about is isolation. The community of folks that are using substances feel isolated, and then because whether it's folks want to avoid the topic or avoid diving into the possibilities of fixing or finding solutions or safer ways to for individuals to overcome their substance use, we then inherently continue the isolation. So I guess this I guess maybe rhetorical, but like just a conversation starter of like, how do we fix isolation if we're going to continue the isolation and continue to avoid a topic that continues to show us day and day again that it's like screaming. It's like a neon flashing light of like, this community also needs help. And what a community is a community, regardless of what makes up that community. And so because it's a substance use community, it means that we have to continue, that we should continue to isolate and avoid because we don't know how to touch it.
Yeah, substance use is an extremely complex and complicated problem, and I think the reason why we push things into isolation, unfortunately, is that we want simple solutions to really complex problems. And a simple solution, although it is not the solution, but a simple solution for decades and decades and decades has been the only measurement of success is abstinence. And that is, at the end of the day, a black and white solution. You're either not using drugs or you are using drugs.
Right.
And if you're not using drugs, you are essentially not succeeding. And if you, I don't know, maybe I messed that up, but if you're using drugs, you're not succeeding. And if you're not using drugs, you're succeeding.
Right.
And it's super unfortunate because it exists on such a spectrum.
Yeah.
And we don't think about that larger spectrum of people who engage in any substance use.
And it's on a black and white spectrum.
Yeah.
There's so incredibly much that goes into substance use and why folks are using substances and what the substance is, what need it's meeting for individuals. And you talk about simple solutions too, and I wonder, maybe, I don't know if you have like numbers or information, but the walking that you do, the going out into the community, the meeting them where they're at in their own environment, like, can you talk a little bit about what that experience is and have what the community is talking about it? Like, what is their perspective? What is their opinion of having somebody come to their street, their home, and, knocking on their door, so to speak, to say, hey, I'm here to help. How can I help you?
I think it builds a level of rapport that, to me, it's a beautiful thing, people are never like when you meet them with dignity, kindness, compassion, and you are just showing up saying like, hey, I might not have an immediate solution for this, crisis that's going on in your life, which is unsheltered homelessness and literally living on the street. But when you show up in a kind and compassionate way, offering supplies, making sure they have information, not treating them as less than, always equal, the relationships that are built are astounding. And so obviously that's a spectrum as well. Sometimes you go to a site and somebody's sleeping and you unfortunately wake them up or something and they're not stoked at you, but when they realize also it's you that continually shows up, that
consistency.
they're also like, oh, it's you, okay.
Have you had success too in terms of developing these relationships and meeting these folks where they're at, and then maybe being able to turn the page in their minds of saying like, maybe he's onto something, maybe this is the right path for me, and just because you came with compassion and kindness, that you're able to move, the marker of people feeling accepted and seeking that love and feeling that love that maybe they haven't felt otherwise?
Yeah, we've seen a lot of success in the folks that we have been able to, find housing solutions for. Some people choose that they want to engage in abstinence-based recovery, and some don't, but I think at the end of the day, that is the last thing that I care about. Like, it's a practical solution of like people don't stabilize in chaos, and so being able to offer that solution to them, however long that takes, and seeing just the small things, the small incremental changes in their lives. Something as simple as being able to sleep on bed at night, or take a shower, changes a lot about how a person is able to show up in the world, and whether they choose to engage in abstinence-based recovery or not. Like, you actually see those small incremental changes, and people smile who haven't smiled in, we work with people for sometimes years, before we're able to access solutions for them, and seeing somebody smile for the first time in like 6 or 7 months is a beautiful thing.
Well, and there's got to be something that's working out there, because for the first time in a long time, the overdose death numbers in Connecticut went down. So last year it was 990, which of course is 990 too many families who lost loved ones, but that number was down from about 1330 the year before. Why do you think that is, or what maybe was the cause of that? Because that's a pretty staggering jump. It was the first time we were under 1,000 deaths in years.
I think there's a large number of things that go into that. Again, complicated problem, not a simple solution, but you were talking about isolation before, and I think that is mostly the problem that we see, especially with the fatal overdose crisis across the country and in our state, is that people are isolated, people are alone, and people are not able to administer naloxone in the circumstances of an overdose. Most of them occur in private residences, and we've been able to offer a multifaceted set of solutions for a really complicated problem, which include things like syringe services, massive naloxone distribution across the state, public health campaigns that talk about those kind of things, overdose prevention hotlines like Safe Spot, where people are able to call the number and use the drugs on the phone if they are alone. And when that happens, if God forbid an overdose happens, the person has 911 or a family or a friend call that can give them naloxone, and the list goes on and on and on. But I think that for the first time we're starting to see this downshift because we've invested money into the community as far as expanding services. We have opioid settlement dollars that are being used for a multitude of different things. We're opening harm reduction or drop-in centers across the state, with a new one coming soon. There's a lot of things that go into it, and I think unfortunately, kind of like at a national level, you hear that it's just enforcement, but we've been doing enforcement for decades. We've spent trillions of dollars, and in the last 10 years, we've seen more deaths than we ever have. So.
We're bringing it out of isolation.
Yeah.
We're consistently talking about it, consistently providing information, and it feels from my perspective that for the first time in a very long time, we're not just keeping it in isolation. We're not, I mean, there are some folks that would rather just not touch it because, again, complicated problem, but I think we're talking about it more, and with talking about it more comes, again, bringing it up from underneath this rock and saying, like, okay, now we're, the first step of a problem is identifying that it's a problem, and I think we're doing that. We're talking about it.
Yeah. When we talk about isolation, it also makes me think of another topic that we've talked about here a lot, is the epidemic of loneliness. Just folks feeling alone, they're not having anyone to turn to, and really, can you talk a little bit about the importance of support systems? And really, sometimes you might be the only friendly face that they see on a given day.
Yeah, I mean, I do love the quote that the opposite of addiction is not a connection. The opposite of addiction is sobriety. Wow. Opposite of addiction is not sobriety. Opposite of addiction is connection. Because the support systems, like any human being, like we can't do the human experience without connections with other people. And whether that's a person that's in like really chaotic substance use, or just any average person that walks around day to day, we absolutely cannot do this without other people. And so whatever support systems are, people need them, and when they don't have them, they find things to connect with, and it goes back to what we were saying before. But being able to be that support system for folks that have, in many unfortunate circumstances, like fallen through the cracks of the system that is built and created to help them, a bunch of different reasons why that could happen. Having those support systems, even for myself, like I couldn't get through day to day if I didn't have my family, my friends, my loved ones, the community that I work with, right? And you have to think about the folks that have none of those things. And isolation and loneliness continues to get worse. We've become massively more interconnected via our phones, but also like massively more distant from each other. And I think we see that in the way that substance use plays out across the country and the world.
You mentioned, your own need for connection, and if you're comfortable sharing, what do you think made the difference for you for finding your way to recovery?
It was a lot of things, but when I was at the end of my active addiction, I remember like getting in some trouble, and I used to like share this portion of my story, and it would like make me well up with tears because I remember that feeling, and it's become more and more distant based on all of the connections I have in my life today. But I knew that I was likely going to jail, and my first response was like, okay, well, at least I'll have people to talk to in jail. And I say that because I know that, like, as I've thought about it throughout the years, like how powerful that is to show how isolated I really felt, and the connections that I built that like made me want to do this are the thing that has perpetuated that, like, and the way that I describe it is that I didn't have those things. I didn't have the connection that I was seeking in my life. I didn't have like close friendships. I didn't really have a relationship with my family, and I felt very isolated and very alone. And drugs transported me away from that, and I didn't feel that for a short period of time. And when I started and entered recovery and started building friendships and employment and education, and relationships back with my family, all those things, what happened was like all of a sudden I went from having a life that I didn't want to show up for, that I didn't want to be present for, and I didn't want to experience the loneliness and the isolation anymore, to a life that I wanted to show up for and I wanted to be present for. And it can be directly seen with like the way that I consumed drugs was I used drugs to seek oblivion. You know, like when I was using drugs towards the end, like it wasn't like I wanted to experience a high, like I just wanted to kind of fade out for a couple hours, and then like I would wake up and be like, okay, I just gotta do it again. So then, you know, moving into recovery and those spaces and building those friendships, connections, education, etc., it gave me a life that I wanted to be present for, and I wasn't seeking oblivion anymore. And when that happens, I think, regardless of abstinence, non-abstinence, even though I'm a person that practices abstinence-based recovery, regardless of any of that, like when you have a life that you want to show up for and the community understands that and allows you that and doesn't push you into the shadows and isolate you and all those things, when you have that, your relationships with drugs changes, whatever that is, whether you're a person who's like chaotic substance use, a person with a substance use disorder, a person who, you know, like uses drugs recreationally, like granted, not 10% of people who use drugs have a substance use disorder. The other 90% of people like have no issue with consuming drugs. But my story of abstinence and substance use is kind of, although it's the anomaly, it's the one that's promoted. And when you look at people using substances, the automatic assumption is like you have a substance use disorder, and that's just not always the case.
I see your shirt too says Safe Spot, and you mentioned that. Can you talk a little bit about Safe Spot and what it might be for folks who don't know?
Yeah. Safe Spot is an overdose prevention hotline. You can call it. It is 24/7, 365 days a year. You don't wait on hold for very long. You can consume drugs while on the line with a person called a spotter, so that's why they call it Safe Spot. A person called a spotter, they stay on the phone with you. A lot of people with lived experience, living experience, etc., that do not judge. They're not shoving recovery down your throat. They're not saying, you know, you need to do X, Y, or Z. They're building the relationship with you. They show you that they care. And the main goal of the line in and of itself is the person is therefore then not alone when consuming drugs, which is where we see the most fatal overdoses occur, private residences and consuming drugs alone. If the person doesn't respond for up to, you know, a minute, and you're trying to get their attention, 911 or a family plan is kind of initiated, so that the caller can either have a plan of, yes, you know, my friend lives in the, you know, apartment downstairs and they can give me an naloxone. That has to be kind of verified to some degree, but or emergency services will be sent to the location and the person that's on the line. There's been minimal overdose activations, I think, with the line, but no one's died using it.
Wow,
That's
incredible.
Yeah. As we approach Overdose Awareness Day, what are your hopes, you know, this year? Obviously, we haven't had the numbers released quite yet. What are your hopes going forward? And, you know, as you do this important work, and you're obviously on the forefront of harm reduction and, you know, waving that flag and letting people know that it works, what would you want somebody who might be on the fence, who's just not on board with it or just not educated with it, what would you tell them?
I would say something along the lines of, believe me, I understand. I understand it might not be the easiest thing for people to wrap their minds around. I think the way that, you know, I explain it in a lot of circumstances is, and I can't quote the exact study, but I believe that folks who inject drugs on an average for about like 10 to 12 years, which is a long period of time. And it's a long period of time to have those, you know, physical, emotional, social, mental harms occur during that time. There's a lot of things that we don't necessarily think of as harm reduction that we use as harm reduction in our daily lives. Seatbelts are a perfect example of that. When we instituted seatbelts in cars, there's like interviews of people who are like, I'm never gonna wear these. And then you fast forward 20, 30 years and you can't get in your car without it going ding, 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 ding. Yeah, and it won't stop until you put the seatbelt on. Yeah. But there's a multitude of things that we do to mitigate risk in what's inherently dangerous scenarios. Like, it's inherently dangerous to get in a car and drive. There's other drivers, people are going 60, 70 miles an hour on the highway, on regular streets, and we don't make cars illegal. We institute something that is going to mitigate the risk associated with the negative possible outcome of whatever the inherently dangerous behavior is. You wouldn't think about getting into a car being inherently dangerous, but to talk to somebody who doesn't understand it, the number of people that I've connected with on a level that is purely human, without any like pre-existing conditions, and just meeting somebody like with compassion without any conditions, allows quite a beautiful relationship to open up. And when that happens, people get well. And that might not be the definition of getting well that we all think is the measurement of success, which is complete abstinence, but small incremental changes. Like, recovery for me is any positive change, and any positive change is what happens within the work that occurs within harm reduction, overdose prevention, risk reduction, all of that kind of stuff. So the best way I could describe it is, don't let the best be the enemy of the good, because too often we do that, especially with substance use. Is, we have this ideal best, and it would be nice if, with everything we did on this planet, to have the best to be the outcome. But we also know that that's not a reality, and we want people to survive. We want people to have lives that are worth living, and we want to show people dignity. And like, that's what community's about. Community is not about putting somebody in the corner. It's like building each other up.
Yeah, and we're human beings at the end of the day.
Yeah.
Well, and I remember seeing firsthand when I was in our Torrington clinic, when you were there with your harm reduction rover and you were passing out supplies, I remember seeing so many patients who didn't even necessarily need any items from you, but just wanted to come say hi to you. And so it was like you had built this connection, and like you say, a lot of these people are lonely, they're lacking connection, they're isolated. How does that make you feel when you develop these relationships and know that you might be that only person that somebody experiences a positive interaction with on a daily basis?
It makes me feel great. And I try not to come at it from a perspective of ego. Like, of course it makes me feel great. But also, I know how folks like that felt, and whether they're experiencing that level more, worse, less, doesn't matter, like, if somebody smiles based on their interaction with you, regardless of where it is, it's just like, it warms your soul.
Do you think that doing this type of work has helped you in your recovery?
Yeah, absolutely. It's also given me a unique perspective into how personal, like, people's recovery is to them, and I think that had I not done this work, I would probably have a much more narrow mindset of like what recovery means to people, and I probably never would have been able to truly feel as though that recovery truly is any positive change, but it was 100%, like, it helps my recovery, but it also just helps my existence on this planet, it's that, like, regardless of recovery and abstinence or anything, like, connection with other human beings is like what keeps me going when things are good, when things are bad, and so it's helped across the board.
Ashley, is there anything you think I haven't asked that you want to ask?
No, I think I feel like we could talk about this all day, but for the sake of the podcast, I think we've covered it.
And Cameron, anything I'm missing that you'd like to share?
I guess I would just say that in the end, as we approach Overdose Awareness Day, and I was in the garden just before I came up here, and I was looking at the bowl for the notes and the remembering our loved ones lost. You know, we've lost so many people. I've lost so many friends. And when you think about those things, you know, as Overdose Awareness Day comes, I think unfortunately we continue to lose people because we have bad policy, you know, and policy shapes the way that people are able to mitigate the harms in their own lives. And we continue to lose people, unfortunately, to that. So, you know, we need to support things that might not seem like the most logical solution from an outside perspective, but we need to support things that, like overdose prevention centers, like overdose prevention hotlines that put people in the room with other folks while they're using, so that they don't lose their lives to overdose. Because that is the problem at the end of the day, is people are using drugs alone and people are dying, and it continues to happen. And I say that with the most love and respect to the family members of loved ones. I would say that as we go into Overdose Awareness Day, you show up with that same dignity and compassion, thinking about every single one of those lives lost, being a brother, sister, mother, you know, maybe you've lost somebody, and being willing to have an open mind and perspective to things that will help people continue to stay alive and feel that connection in their daily lives. And it's happening, but if we want these numbers to continue to go down, we can't lose sight, and we need to understand that what we've done so far is working, and it's not time for us to pat ourselves on the back and say this is great. It's time for us to keep doing what we've been doing, because, as you said, 990 is too many, you know. One is too many.
One is too many, and one is preventable, and we can do our work to try to move that direction forward. All right, well, Cameron, thank you so much for joining us today.
Thank you.
We appreciate you tuning in to another episode of Rooted and Real. We hope you enjoyed today's topic. As always, stay connected with us on social media to find out about new episodes and keep the conversation going. What should we talk about next? We want to hear from you. Until next time, remember to keep it rooted and real.